Okay, so just to say thank you all for being here with us today. I have attempted to mute all of your all's lines to limit the feedback. You all can unmute yourselves if you choose to do so and ask a question. We're going to try to stop periodically and give you a chance to ask questions or make comments. But if there's something that you need in the meantime, feel free to chat your questions over in the box, and we'll try to monitor that also and keep things moving. So I have a rough agenda for today. We're going to start with PPE situations at your facilities, personal protective equipment, any kind of inventories or shortages and gaps that you all may have, and talk a little bit about a request process for those types of items. Then we're going to move into strategies to prevent COVID-19 in certain facilities and in congregational group type settings. And then we're going to get into guidance for when you have a positive case, either in an employee or in a resident or inmate, how you would handle that. And then the very last thing we're going to talk about is disinfection and cleaning procedures and protocols that you may want to be implementing. We're going to get started. I just wanted to have a space call and see where you're at with your PPE. Hopefully you all have something that you're using or some kind of protocol of when certain things happen and you're going to start using, if you have someone you suspect or a person under investigation or whatever the case may be. If you have PPE, I don't know how to, there's not a way for you all to raise your hand, I don't think, in this feature, but if you have, I guess if you have a PPE need, if there's something that you know that you're short on or you don't have enough of, can you also type that in your group chat over here to the side, along with what facility is requesting, and we will try to make sure that those needs get accumulated into a list. We will be sharing this list of needs with our county emergency managers and with all of the state agencies and things who are asking for this information, so that we can properly distribute what little bit we do have to the agencies who need the most. The request process for PPE generally falls to your county emergency manager, so hopefully you all know who that is. I will try to do this from memory off the top of my head. Adair County, your emergency manager is Mike Keltner. I don't think they're on this call today with us, but I have that information and can share phone numbers and things with you if you need that information for your county emergency managers. Mike Keltner is in Adair County. Casey County is Rick Wesley. Clinton County is Lucas Abner. He's also the EMS chief there. Cumberland County is Greg Carey. Greene County is Bill Matney. McCurry County is Tim McKinney. Pulaski County is Stacy Holcomb. Let's see, Russell County is H.M. Bottom. Taylor County is Ronnie Dooley. And Wayne County is Bubby Corder. So hopefully you all have those names in your emergency plans and protocols and procedures. If you don't, reach out to us after this webinar ends, and we'll try to make that connection for you. You just tell me whose name fits with your facility, and I'll get you that information and make a contact for you. So go ahead and chat over. Like, I see lots of requests coming in of things that are limited supplies or that you don't have enough of. So that's good to know. We need to know where the shortages are so that things can be properly routed. I'm going to go ahead and introduce the people that are in the room with me. At the health department and the operations center, we have Laura Woodrum, who's our director of nursing. She's in charge of our medical operations. We have Dr. Christine Wayman, our medical director here for the health department. And we have Stuart Spillman and Sam Price, who are with our environmental operations section. So this first part that we're going to talk about is strategies to prevent COVID-19. I'm going to let Dr. Wayman and Laura talk about that. Amanda England is also joining us remotely, I should say, before I move on. She's our regional epidemiologist, and she's actually in Cumberland County. Her office is there, but she's the one that's doing all of the case investigations and trying to receive notifications when we get positive cases, and then we distribute those out for investigation to the appropriate counties. So she's a very important part of this process. So I'm going to let Dr. Wayman and Laura go ahead and start with strategies to prevent COVID-19.
Good afternoon, everybody, and we appreciate you joining us on the call. I'm Laura Woodrum, like Amy mentioned. Just a few things to review, which I feel like maybe you're doing part of them, if not all, but we just wanted to reach out to you all and see if you all had any questions. First off, ensuring that employees have sick leave policies, or that they're aware of that, or you all have something in place. We don't want folks that might be sick feeling pressured to come to work, and so that's the first recommendation we make. Enforcing and making sure that proper hand hygiene is being followed, and if they're not able to wash, is hand sanitizer available. We need to stop all visitation. If you're still having visitation in your facility, that needs to end, which I think that was an order from the governor, but we just want to reiterate that. Restrict and minimize transfers in and out of your facility. If you do have a new transfer or a new person come in, whether that be in your detention center or another facility, anyone new needs to be quarantined or kept away from the general population for at least 14 days. Postponing non-urgent outside medical visits. If it's an emergency, they can leave daily or once a week or whatever, but if it's something non-emergent, it needs to be postponed. Let's see. When staff come on duty, their temperature needs to be taken. You need to have something in place to be able to take staff temperature every single day and every single shift. If you're limited in space, if you bring new people in, you can cohort them together as long as they're not having respiratory symptoms. If they were to begin having respiratory symptoms, you would need to get them isolated immediately. If an employee were to be working and begin to have either fever, cough, shortness of breath, they need to be taken out of the facility and a mask put on them. For detention centers, consider suspending or stopping your work release programs. If you were to have a staff test positive for COVID-19, you need to inform the health department immediately. If we hadn't been contacted by whomever did the test or the lab, we would need to do contact investigation immediately and start helping you in your facility to figure out those contacts and other employees that may be affected. I think that's all I have, Dr. Wayman. Those things more.
I am Christine Wayman. I just wanted to add that, that if you don't have a case in your facility now, then the only way it'll get there is through the people that are coming and going, namely employees or new admissions. That's why they need to be quarantined, and that's why temperatures of employees should be taken, as well as they should be asked about symptoms of respiratory illness. Since the governor and the CDC has now suggested that everybody wear face covering, face masks, homemade or otherwise, when they go in public, that can be a suggestion for you all. If you cannot keep a distance of 6 feet, then you may actually want to wear a homemade mask, which I'll describe which ones are the best to have in a minute. These protect you from people spitting at you effectively and from you spitting at them. So it's a two-way stream, and they can be washed and reused, so that's something you may all want to consider. Now, once you have a case, then you have to assume you're going to have more cases, in which case, yes, you must all wear, as employees, some kind of surgical masks. I don't know if your inmates or your residents need to wear them. At least those ones that have symptoms need to be isolated if you can do such a thing. And if you cannot, then you need to cohort them. Somebody who's positive can be kept at your facility in an isolation, obviously until they get sick enough that they have to go to a hospital. The kind of homemade masks, we just found this online, that are best are the ones that when you look through them, you don't, at a light, you won't see it very bright. And there are three ways that make the best masks. The best constructions are 2 layers of heavyweight quilter's cotton, or 2 layers of thick batik fabric. I hope you all know what that is. And the third one is a double layer mask with an inner layer of flannel and an outer layer of cotton. These were found to be the best by those who were testing them. Whatever you use, it probably should be double layered or maybe even triple layered. Where are we? Help me. Anybody have any questions at this point? Anybody putting anything into the chat box?
I don't see any questions yet on the chat, but if anyone has a question and wants to unmute your line and talk about prevention strategies before we get into what to do when you have cases, you can go down to the bottom left side of your screen and the little microphone icon. Just click that and it will unmute you and you can ask a question.
The other thing I want to say is if you, well, I think I already said it, but if you do have a case in your facility, all employees must wear a face mask. Surgical mask will do. This is a droplet disease. And the one thing I want to mention is for those wearing gloves, you have to make sure that you don't suddenly decide that just because you have gloves on, you're protected. They are now the extension of your hands, and they need to either be cleaned or changed frequently.
Okay. I know a lot of you all are in very unique settings. You have I see Heather Nicole, I think, had unmuted. Do you all have a question?
Oh, sorry. I do have a question. Heather Grigsby from the Healing Place. So I didn't quite catch the part where I believe what you said was if there's a work release program that you all are suspending that. Now we have phase 2 clients that some of them have brought us letters showing that they are essential employees. So we've moved them all onto our 3rd floor, which is the 3rd floor is all the buildings connected, but the 3rd floor is kind of up by itself with a couple of rooms on that hall where we could put all of those guys together down that hall where they're not mixed in with the rest of our clients. Or are you guys recommending that they, no matter if they have a letter like that or not, that we just shouldn't have them going out, period?
Do you understand the question?
It's a residential drug treatment facility in there. What she's saying is they have some who go out and have essential jobs.
I see.
So they're going out and doing their jobs and coming back in, but they have separated them out to one floor all to themselves, so they're not intermingling with the rest of the population. And to me, that sounds like they've taken their appropriate steps.
That sounds very reasonable. I don't know what kind of jobs they do, but once again, if they are within 6 feet of whoever they're doing the job for, they need to be wearing a surgical mask or some kind of homemade mask.
Did you hear that answer, Nicole or Heather?
Yes, I did. Thank you very much.
Okay. Do you all have masks? Do you have things for the people who are leaving?
No, they do not have. We have 0 masks. We ordered some over a month ago that we've still yet to receive. The only mask that we have here currently is a lady out in the community made me like 20 of them, but as not including our phase 2 guys, staff alone, there's 12 of us. So we pretty much used all of those.
Okay.
Okay, we'll just need to ask those ladies to make you some more.
I put the word out there, so I'm hoping, because I know she's helping out other people too. I haven't heard anything back, so I'm hoping she's going to be able to do that for us again, but I haven't heard yet, so.
Reach out to your county emergency manager, Mr. Dooley, and let him know that you all have a need. And I don't know that they have anything left in their supplies, but if they do, maybe you all could reach out that way and get a little bit of assistance.
Okay, and you'll be able to give me his number, right? Because this is the first time I've heard his name, so I would need that contact information.
I can get that for you. And you did say Healing Place, correct? The Healing Place?
Yes, ma'am.
Okay, yeah. Yeah, I will get that for you after this call. I'll make sure I get in touch with you.
Perfect. Thank you so much.
Thank you. Are there any other questions on prevention before we get it started into when you have a case? Okay, then we're going to roll right into guidance for what you do when you have either a confirmed worker or resident or inmate. Dr. Wayman?
I think I've already said a lot of this, but I'll say it again. If you have a confirmed, obviously that person has to be isolated, and we'll let Stuart discuss the cleaning procedures. But people that have any contact with this, in fact, the whole facility needs to wear face masks. And I don't mean N95s, because nobody has those, but just the surgical masks or the homemade masks. Obviously, wash your hands, wash your hands, wash your hands. Anybody who was a contact to this person, and that makes it difficult, then becomes quarantined. Sometimes it can be 20 people because they've all been in the same cell or the same room. Well, they do have to be quarantined, and they have to be monitored for symptoms, temperatures twice a day, particularly in the evening, because if you're going to spike a fever, that's when you do it. Anyone who has symptoms consistent with COVID-19, such as cough, fever, shortness of breath, you assume they have it until proven otherwise, until you get a result that says negative or positive. They're positive, once again, you isolate. Testing, I'm sure if you let us know, or the state, they will let you test. Of course, you have to collect, somebody has to collect the sample. I don't quite know how that happens in jails. Does anybody? Well, you have, some people have nurses, so they could.
Yeah, they have nursing staff there.
I hope the jails do have the transport medium in the tubes and the paraphernalia you need to do a test. If you don't, you might want to ask for some from the state or from the lab that you all use, Quest or LabCorp.
Okay, any questions about what to do if you have a positive, either an employee or a resident or inmate? Okay, before we move on then, I want to remind you to please go ahead and shout your name and your facility into the feature at the bottom, the chat box. And we use a system at the health department, and I think most of you all are in it because I used it this morning to notify for this meeting, or else your local health department person that contacted you maybe about this meeting may have completed a registration form for you, but we use a system called ReadyOp. That is our way of notification for all of our community partners. So that is a system that it allows us to either email, make a phone call, or send a text message to our contacts that we have built up in there. So that's a very quick and easy way for us to get information shared out to you in a timely manner. So hopefully you all are in that. If you're not, text that or chat that over in the box if you need to know about how to be a member of the register with the ReadyOp system, and we can get you that form and get your information. We send out at least every night, every weeknight at least, I send out the public information brief that has our total case counts for the district, some prevention tips, any kind of extra things that the health department is doing or working on. All of that information goes out every day. So you definitely want to be getting that information. And after this call today, we will be sharing information through an email with you all about testing information, employee temperature monitoring, and things like that, some cleaning information, just all sorts of checklists and guidance and things that you all may have already been thinking of and looking at. But if you haven't, it's a good place to start. It's kind of everything, a condensed version into one email. It'll actually come in 2 emails, I think, because some of the files are so large they wouldn't let me send them all in 1 email. So it'll probably come in 2 emails to you. At this time, I'm going to ask Stuart Spillman to go over with you some guidance on cleaning your facilities and procedures for how to disinfect.
Okay, so I want to go over 3 different areas of cleaning. First, just some general procedures to clean your facility, because as people are out and some of the symptoms are latent on this, it takes a while sometimes to get sick, even though you've been infected. So we are already recommending, at least at the public, that you treat anyone as infected. So generally, in your facility, you want to make sure that you clean all the surfaces before you start to disinfect those surfaces. And then, once you do clean them, you want to disinfect all the high-touch surfaces throughout the facility multiple times a day. So door handles, sink, faucets, toilet, the flusher, different things like that that people will be touching a lot. You want to clean and sanitize those multiple times daily. If you have a soft surface, like couches, chairs, you can clean those with soap and water or the proper cleaners. If it's possible to launder the cushions, do that. Use the EPA disinfectants from the list in. So if you will just Google EPA disinfectants for coronavirus, you'll find that list in with all the disinfectants listed there. It's best to use hospital grade disinfectants in your facility. And you need to make sure and follow the contact times to allow that disinfectant to become effective. So if it needs to stay on for 2 minutes, make sure you let it stay on for 2 minutes. If you cannot get disinfectants, then you can mix your own. You can use 1,000 to a 5,000 part per million bleach solution. If you go with 1,000, it's a cup of bleach to a gallon of water. And if you go with the 5,000, it is 1 and then 2/3 of another cup of bleach per 1 gallon of water. As far as all the linens go, you would just launder them as normal and ensure that each room has hand soap, towels, warm water, and if it's possible to have hand sanitizer, it is a good idea. As far as your dishware and utensils go, just clean those as normal. That's your general procedures. So now, if you do have a case in your facility, and we know that people will have to go to the hospital, just like Dr. Wayman was saying, some won't be sick enough. So if you have those people there at your facility that are positive, then make sure that that person is isolated. Make sure that only the essential personnel is entering that room where they're at. Cleaning should be performed by the staff that is caring for the patient. So if you have a nurse on staff, they're caring for that patient, then the nurse should be cleaning the room also. Disinfect the room again with 1,000 parts per million bleach solution up to 5,000 or the hospital grade sanitizer. Any kind of medical equipment that you might need in that room, be sure and dedicate it to that room. And if you can't, then you need to clean and sanitize that. Use disposable food trays and utensils and have that food delivered to the patient by the staff that's caring for that patient. Launder all the linens in hot water and then dry them as normal. Be sure and use gloves to handle the laundry. and keep a waste can by the door to dispose of all PPE that staff may be using to enter that room, such as their gowns. When somebody has came out of isolation, so they're okay now, or they've left the facility, one of the two, then that room, make sure and open the windows and doors to the outside, put a fan in the room, let it ventilate for 24 hours before cleaning. And then the cleaning staff that does go in there should wear gloves and gowns. They don't have to wear a face mask, but they do need to wear eye protection, face protection to protect from splashes, and clean every surface with that, the bleach solution or the EPA hospital grade disinfectant.
Thank you, Stuart. So that is disinfection and cleaning procedures. We've talked about prevention. We've talked about mitigation once you do have a case. And then we talked about cleaning and all of those protocols. I want to open up for questions if you all have any. But before we do that, I want to make sure you all have a couple pieces of information that you're going to need. We have local planners in the health departments in the counties that can assist you with questions or try to help you locate resources or that are just there to answer your questions. So if you want to jot these names down also in conjunction with the ones I've mentioned before that are your county emergency managers, these are people who could potentially be a resource to you. They work directly with me and Sam here at the district office, and they are the ones that are out in the counties and relay information back up to us, and we try to assist in getting those kinds of needs met and addressed. So in Adair County, it is Corey Patterson. In Casey County, that is Courtney Roberts. This is also typed over in the chat if you don't catch the name when I say it. Clinton County is Vicki Albertson. Cumberland County is Chastity Patterson. Greene County is Savannah Lewis. McCurry County is Jared Simpson. Pulaski County is Hamilton or Jefferson Hickman. Russell County is Jonathan Dye. Taylor County is Connie Arnold and Rebecca Lejeune. And Wayne County is Laura Beth Spears. And I think most all of those people I've seen are on this call too and are listening in, so they're getting the same information that you all are getting today. And of course, they know a lot of this already, but we just like to include them so that they can make the connections too. One question that we have in our chat box before we open up for questions otherwise is, who does my medical staff need to contact to get what we need to do the test? Laura or Dr. Wayman, can either of you answer that question?
Well, who do you have lab service now? If you have to have labs drawn, who does that for you now?
I think that's Wayne. That's Wayne. Let me try to unmute you so you can talk. Wayne, can you answer? I think I've unmuted you.
Can you hear me?
I can. Yes.
I'm going to let my nurse tell you what she does. I've got her up here with us.
Okay, great.
About what now?
When you do labs.
Oh, we just send them to Garcia Labs.
Okay, so you would check with the lab that you're contracted with and see if they have test kits that they could allow you to have in case you were to need to test. Okay?
Okay.
If they don't have them, who would we need to contact after that?
Okay.
Well, I personally would ask them who they recommend that you reach out to.
Okay. All right. Thank you.
Okay. Are there any other questions that you all want to ask while you have willing to answer and provide assistance? Just go to the microphone at the bottom left-hand corner of your screen, I think, and unmute yourself, and you can ask your question. Okay, I'm not hearing any questions, so that's maybe a good thing. Hopefully you all are thinking along the lines of what you're going to do if this comes into your facility. how you're going to protect your employees and your staff as well as your population. Before we disconnect for the day, I should have done this at the very beginning, and I had not ran it by Amanda, our epidemiologist, so I apologize. I kind of put her on the spot with the text message and asked her to give a brief update for you all, so you know where we are in the district. We had our very first case in the district a few weeks ago. Last week, we had our very first case in a long-term care facility, so that got us really scrambling and thinking like we need to reach out to these populations where you all have a population that's contained and confined in a small space, and get you to thinking of how we can handle this together. Amanda, go ahead and unmute. I'm going to try to unmute you myself. I think you're unmuted.
Can you hear me?
Can you go ahead? Yes.
Okay, so where we are, case count, just to let you know, those totals were as of this morning. Of course, we may have different totals this afternoon. Adair County has had 3 cases. 2 of those are hospitalized and 1 is self-isolated. And when we say self-isolated, that means they're in their home setting. Clinton County has had 1 case. They are self-isolated. Cumberland County has had 1 case that has been released from isolation. McCreary County has had 2 cases. 1 has been released from isolation and 1 is on home isolation. Pulaski has had 24 cases. 3 of those are hospitalized, 11 are self-isolated, and 9 have been released from isolation, and there has been 1 death in Pulaski County. Russell has had 3 cases, 3 are home self-isolated. Taylor County has had 3 cases, 1 is self-isolated, and 2 have been released from isolation. And Wayne County has had 4 cases, 2 are hospitalized, and 2 are self-isolated. So a district total of 41 cases. We have 7 hospitalizations, 20 people are home isolated, 13 have been released from home isolation, and we have had 1 death.
Thank you, Amanda. So you can see these numbers are growing. We've seen continued growth. Last week was our biggest week, of course, and now we expect this week to be another big week for these numbers. Besides just the confirmed cases going up, we're having quite a bit of those who are sick being hospitalized. So that's always a disturbing number for me to see, is that the number of people who are truly sick enough to be hospitalized over this. Hope you all have learned something today or have gotten some valuable information that will help you all. I will be reaching out to you with a follow-up email that will contain a lot of these checklists and the specific guidance and things that were spoken about today, so you all will have that in writing. If there's anything that you need from us, feel free to reach out to the local person, the planner person that I mentioned earlier, or to your county emergency manager, or call us here at the district health department office. We are willing to help you all with whatever we can. See, I got one other question, it looks like, before we close up. If a staff member has been in contact with a community member who later tests positive, do you also quarantine all who have been in contact with that individual? So it sounds like maybe a question about contact investigation and tracing. Can anyone help with that question?
Staff members.
The contact of the contact does not need to be quarantined, but the contact does.
Dr. Wayman says contact is contact. We call that, I think, a secondary contact or something. We're not necessarily recommending quarantine for that level of person, but the contact would definitely need to be quarantined. Any other questions? Okay, well, we greatly appreciate your time. Please let us know if we can be of assistance to any of you all, and have a wonderful afternoon.